doctors. And, they take care of me over there at the Sahara West Urgent Care, which is located at Sahara and Jones, right down the street from where we are. And one of the doctors that works in that facility, he's been on this show before, who I have a tremendous amount of respect for, is Dr. Michael Bradley. And I love the fact that, Doc, you're in the suit, man. You're ready to go. I like it. I like it. You're ready to do your surgery.
Work down then,
I like it. I like it. Well, Doc, thank you so much for being here. I appreciate that.
Yeah, my pleasure.
Let me start with what a lot of people seem to be concerned about, because we don't know how serious it is. Monkeypox, right? So talk to me about the latest. What do you know about this monkeypox? What do you know about it? And should people in Clark County be concerned about it?
Monkeypox, if you would have asked me, 6 months ago, I would have been like, what's that? It's not even really an issue, but it absolutely has changed a little bit. So I pulled some numbers right off of the CDC. So that way we're getting it straight from the horse's mouth, so to speak.
Yep.
15,433 confirmed monkeypox cases in the United States.
That's a lot compared to where we were a month ago, right?
Like literally 5 days ago was 10,000.
That's a lot.
Yeah. We had a little bit of an increase. And I think that if we want to talk a little bit about like how monkeypox, where you actually realize that you've got it or not, it's really concerning. You'll get infected with this thing and you'll have it for about 3 weeks before your first notable POC actually shows up. Where you're like, wow, maybe I should go get that checked out. And then you'll be contagious with that POC at least until that POC goes away. So that entire time, it's anywhere from 2 to 4 weeks.
Wow.
So we're talking almost a 2-month total process from infection to getting over it. That's a long time.
So you hear some people say, and tell me if there's any truth to this, that in the gay community, this is where you have a much better chance of getting it. Can you just get rid of all the theories and the opinions, and what's the truth when it comes to this?
So, let me talk a little bit about what monkeypox symptoms. No, not symptoms. I want to tell you, because we'll get into that in a second.
Sure.
Let's talk about how you get monkeypox, right? Yep. All right. So, and then you tell me if this is necessarily a homosexual thing or not, because I don't think it is. Direct contact with someone with monkeypox rash, scabs, or bodily fluids from a person with monkeypox.
Right.
Touching objects, fabric, clothing, bedding, or towels and surfaces that have been used by somebody with monkeypox. That's why we're starting to see some of these kids get it. They're not homosexuals. They were just, touching behind somebody that had it.
Right.
And then contact with respiratory secretions. That's basically, I'm sitting here talking to you close enough. And you know how kind of sometimes a little spits kind of come out a little bit from the mouth? Boom, you got it. That's got nothing to do.
So could it be possible? That makes sense to me.
Right.
Very similar to COVID in some aspects, right? Where it lives on objects. We learned. So is it possible that maybe it started that way,
right,
and now, listen, just about anybody can get it, right? Because it's spreading so fast.
Yeah.
Is that fair to say?
This is a pox.
Yeah,
it's absolutely a pox. So
more or less deadly. More or less deadly.
No, I don't think this is really deadly.
Yeah, just kind of gross.
Yeah, I think it's painful. I think is really the stuff that I've heard from people that have actually had it. It's just a horrible thing to have. If you ever had, of course, chicken pox isn't so bad, but if you've ever had, adult onset chicken pox, you know what that is, and it makes you miserable for a month straight. Yeah. Well, this is exactly the same thing.
So with COVID, we know that a lot of symptoms, sore throat, it starts like a cold, or maybe the start of a flu or a cold. We pretty much know our body is telling us when we're getting sick with something, right? We get those symptoms. So with monkeypox, what are those symptoms?
I got them right here.
Okay.
You're going to love this. All right. The rash itself will go through several stages. So it'll start as a scab and it'll through all these different stages before it finally the scab peels off and then skin heals over it. And then when the skin heals over it, that's when it's no longer contagious.
Okay.
So it's like a whole process.
Right.
But some of the other things that you can look for are fever, chills, swollen lymph nodes, exhaustion, muscle ache and backache, headache, respiratory symptoms like sore throat, nasal congestion, or cough. What does that sound like?
Wow, that's interesting to me. I didn't know that those were some of the symptoms. So it sounds like COVID, doesn't it?
It sounds just like COVID.
Yeah, I mean that is wild. Where do they feel like this originated from? Where did this start?
Oh, you're asking another. It's kind of like the same question about where did HIV come from, and all these different,
right.
And I think there is some ties to Africa a little bit, but it's just hard to be able to pinpoint anything. But what I find is interesting is right now the United States is leading in the number of monkeypox cases. We are number one.
Why is that?
I feel like we might just have worse immunity overall, and it's starting, a virus will be opportunistic and it'll really look for its opportunity to jump, and maybe us in the United States are a little bit more unhealthy than we should be.
That's what I was just going to say. I mean, can it just be that we are just a really unhealthy company? We have obesity. I heard that 2/3 of the country have comorbidities of some sort. That's really staggering. It's terrible. Is it the food we eat, the lack of exercise? Why are we such an unhealthy country?
I think it's a combination of everything. I mean, you look at the environmental factors that cause us to get unhealthy, the ease of food that are high in carbohydrates and the different things that are really not very good for us, sugar and everything that we eat, the lack of sleep because of stress.
Right.
You could pin it to like 50 different things that each American goes through on a regular basis. And say that is why we are the way we are, and we're all that way. This is a boat that we're all in. I don't care who you are.
Yeah, no, I hear you. If you're just joining us, we're speaking with Dr. Michael Bradley, works at the Sahara West Urgent Care facility that I have been at as well. They do a great job over there. By the way, at Sahara West Urgent Care, they take most insurances. You don't have to have an appointment. If you don't have insurance, $95 copay. Please check them out, Sahara West Urgent Care. That's where Dr. Michael Bradley practices over there. Have you had any cases of monkeypox over there at that facility?
No, not yet. But I got to be honest with you. In Las Vegas, or actually should say in Nevada, we're a little bit lower than, let's say, California, but we're higher than like Arizona. We're higher than the states around us. Mm-hmm. So it's one of those deals where it is just a matter of time.
So what you hear from people that get COVID is, okay, if you're positive, you don't have to go to the hospital unless you break a pretty serious fever or you're having some issues breathing,
right?
Which I had both of those, sadly, a couple of years ago when I had to go to the hospital. So when it comes to monkeypox, when is the point where you need to say, or your spouse or whoever says, we got to take you to the hospital because we're at that point now where it's serious enough?
So it says specifically on the CDC website that if you don't have a healthcare provider or health insurance, visit your public health clinic if you get this.
Yeah.
But it also very specifically says, kind of tell that healthcare provider that you have it, because they are going to have protocols into actually bringing you in with an infectious disease like this into their clinic. I'm sure Sahara West would do the same. Call first.
Right. So we need to stop. Is it fair to say, doctor, we need to stop this rhetoric? Which is, it only affects the gay community. If you're straight, you're going to be just fine. Doc, I hear this stuff and I know it's not true. And based on what you're telling me on the facts and what the CDC is saying and all this other stuff, that's not true. Kids are getting it.
Yes.
So that's definitely not true, right? That's got to stop, right? That's medical misinformation.
It is. And even when we talk about the kids, the reason that this is such a kind of a scary disease that, even pregnant women can give it to their fetuses. It can be transmitted, through, so it's just kind of one of those things that monkeypox, in my opinion, is definitely something to be concerned about, maybe as much as COVID to some respects. I don't think it's going to put as many people in the grave as COVID did, but talk about adding that to our list of stressors that all of us Americans have to deal with.
Is there any sort of vaccine? There's no sort of vaccine or anything out there, is there?
There is. Yeah. In fact, I know for a fact that the department, Southern Nevada Health District, had vaccines for monkeypox.
Yep.
So it'd be one of those things where you'd have to call over there, see if they still have it. I don't think we have it at Sahara West yet, but they do. So if you're one of those high risk people that that you just want to take that, you want to just take that off the table for you, a vaccine would make a lot of sense.
Gotcha. Okay. Where do you think, and this might be a tough question for you to answer, but where do you think we're going to be in a month from now? You said there's around 15,000 cases. Where do you think we're going to be in a month, 2 months, 3 months?
Well, 5 days ago, we were at 10,000.
So 5,000 people in 5 days, less than a week. Wow.
So if you just do that math, we could be looking at some serious numbers pretty fast.
Wow.
I hope that's not the case. I mean, a lot of times we see these things kind of bubble and then they just disappear.
Right.
And I'm really hopeful that that's what happens. But we are kind of really at the beginning of this, and it's a scary beginning.
Yeah. Well, I hope people take it seriously, because I think that, to be honest with you, Doc, and I think you'll agree with me on this, when COVID first came out there, and maybe even I was one of them when it first started, then when I saw how many people were dying, I took it very seriously. But I think when COVID got out there, I don't think a lot of people in this country took it very seriously, quite frankly. They weren't putting masks on. They weren't protecting themselves. And then all of a sudden, all these people, we were losing 4,000 to 5,000 people a day.
Right.
We don't want that to happen here. So I'm hoping maybe if we can take anything good out of COVID, people will look at monkeypox and say, hey, we don't want this to happen like what happened with COVID. Let's take this seriously from the beginning. Maybe. I'm hopeful. right? That people will do that and will take it seriously because we don't want to go there. Let's talk a little bit about COVID.
Okay.
Because some people have a misconception again that COVID is just gone. Okay. I know people that have caught COVID over the course of the last few weeks, even. So talk to me about COVID. Where are we at right now?
I have someone I know personally that got it at the airport yesterday. I mean, they tested positive yesterday. So is COVID gone? No, 1000% no. Are we seeing a very big lull right now? Yes. Why? Because the 0.5, if you will, was very, very, very contagious. And we didn't really see anything kind of emerge beyond the 0.5.
Yeah.
So we had, we had Delta and then Omicron, and there was always something that was going to take the place that was more contagious than the previous one. The reason a lot of people think this is over is because we don't seem to see anything right now that's the 0.6 or the 0.7. That being said, we should not fall into that mindset that this is done and it's a memory, because I don't believe it is. My understanding from some of the things that I've read seems to suggest that 0.5 is something that you can get every 30 days. So you're not building any immunities with that. If that's truly the case, then people could get infected over and over and over again.
Do you recommend that people get their 4th booster or 5th booster, whatever it is? Do you recommend that?
I read somewhere that the newest one actually has an Omicron element to it. So if that is the case, then yes. If that is not the case, then at this point, I'm not so sure. Because you're kind of, you're inoculating yourself for something that is not currently what the concern is.
Let's talk about masks. Do you think people should still be wearing masks? I know the CDC is not necessarily saying you have to anymore. What are your thoughts on masks right now as opposed to we were at, say, a year ago?
I think what we found over the year, if you will, is that, the cloth masks were almost a waste of time. We found that even the medical grade masks were only giving you about 30 minutes of protection, and then your N95s were really the only thing that was truly giving protection. So if the only one that's truly giving you protection is something that's almost impossible to breathe through, I think maybe just being a lot more safer and a lot more cleaner, and just being wise about your location, the people you're around is probably a better way to go at this point. I think this is just too contagious to say that masks are the fix to the problem. And the CDC would agree with me at this point.
Is it true? Because I say this on the air a lot, and I think it holds true, that at least 8 out of 10 people today that are in the ICU units from COVID, that are on ventilators, that are in the ICU, or those that are unvaccinated. At least that's what I hear from a lot of doctors in a lot of hospitals.
It's harder to put your finger on it because there's just a lot less people in the ICU with COVID, you know. And I guess the question is, are they in the ICU with COVID because of COVID, or are they in the ICU because of they need to be in the ICU and COVID just happens to be going along because they've got weakened immune systems? So I think it's real difficult to say these are unvaccinated people that necessarily are in that place. I think at this point, just about everybody's been vaccinated or has some level of immunity based on having COVID, whether they realized it or not. And we're just in a different phase right now. That being said, I know people that are fully vaccinated that when they got this Omicron, 0.5, were sick as dogs. I know for my own eyes saw it. I'm telling you. So I guess the question is did that immunity for really the alpha version of this help them more than not having it? And I
understood.
I think the science is still going to have history is going to tell us, but we may not know for 10 years.
What do you say to somebody even today? They say, listen, I'm healthy, I'm going to be just fine, and they still refuse to get vaccinated. I mean, what would you say to somebody like that?
I think at this point, it just became such a personal choice. And the unfortunate thing is that there was so much misinformation that hit initially. There are some people you will just not convince them one way or the other, period.
Right.
And so the sky may be blue, but they just don't see it that way.
I mean, I've heard stories, Doc, and I know infectious disease doctors and people that work in this town, as I'm sure you do, that have told me a couple different things. Literally, people almost on their last breath said that they didn't believe that COVID was real. And then I've heard other people that when they get admitted into the ICU and they have COVID, they beg for the vaccine.
Sure.
And of course, the doctors say it's too late.
Yeah.
I mean, you hear both sides of this, and it's got to be very frustrating for somebody like you or any doctor for that matter. You dedicate your life to what you do, and you hear people that are just so misinformed, right? So misinformed. And you're right. You can't change their minds.
No, we politicized this. It got out of the hands of the doctors, and anyone who doesn't believe that, I mean, you look back on what happened over the last few years, and it's just clearly been it went away from those of us that medically treat, and it went into the hands of people that wanted to scream and shout and just be upset at whatever was going on instead of really taking it, like you said, seriously.
I mean, I would imagine you're one of those people that got vaccinated.
Oh, absolutely.
Right? Absolutely.
Yeah. I was one of the first people in there,
which I'm happy to hear.
Yeah.
There are some people, well, there's 1,000 or, 1,000 or so doctors and nurses that didn't get vaccinated. And then we look at the actual stats, and correct me if I'm wrong, but the numbers that I've looked at, over 90% of all infectious disease experts, doctors, nurses, even all those administrators that work in the hospitals, 9 out of 10 of them have been vaccinated. Right. So how could anybody come up with the theory that these vaccinations are so dangerous and I don't know what I'm being put in my body? It frustrates the hell out of me.
I think a lot of the hesitation with some of the medical professionals was that a lot of the vaccines that we've seen over the years, it was never the first version that was the best. It was like the fourth version that seemed to be much better. Mm-hmm. So we kind of saw that with things like HPV, for example. The HPV vaccine kind of went down that same path. And it wasn't the first one that was good. It was the third or fourth. So when this thing came, and it came as fast as it did, there was obviously a lot of skeptics, because we've seen vaccines in the past be the first version. We wanted the vaccine, we wanted the protection, but there was that hesitancy. And I think that all of us had it. And then you throw hesitancy with misinformation, and before you know it, you've got, founded belief. And when that happened, that's when we saw, even the best of us questioning things a little bit. Yeah.
So we've talked, doctor, and by the way, if you're just joining us, Dr. Michael Bradley, Sahara West Urgent Care, located at Sahara and Jones. They take care of me. I always sound like, when I say I'm also a client, I sound like a Rogaine commercial, but when you look at the lack of hair, that definitely would not be the case. But then no, they do a great job over there, and the great work that you guys are doing over there. I really appreciate some really good people over there. All right, let's have a little bit of fun here. We've talked about a lot of serious topics and important topics, and I'm so happy to talk to people like you and your expertise about topics that, quite frankly, a lot of people don't know a lot about, and they spread things that are not true. I'm glad to get some facts from you. I heard a rumor that you got a documentary coming out, that you're going to be on the big screen. Is that true?
Yeah, that actually is true. And what will surprise you is that it actually is what happened. I got to watch this thing, and it's probably one of the few documentaries that exist about when Vegas shut down, and kind of the perspective of really three individuals. You got a homeless person who to this day lives underneath the tunnels of Vegas. You got a doctor who was just trying to do something because the whole world had shut down and everything had shut down. Yeah. And then you had a politician. So you got kind of the three perspectives. A person who didn't care about COVID because they were worried about the rain coming. Right. You got a person who really cared about COVID because he was trying to test as many people as he could and help and save as many lives as he could. Right. And then you got a politician who just didn't really want to believe or took the side of people who didn't.
So they just follow you around?
Yeah. They were out when I was out, doing swabbing and stuff out in the middle of the street and stuff like that.
Is that weird? Like having a camera follow you around every year in your everyday life? Is that strange?
I think what was weird is when they went home with me and they wanted to see how. Yeah, that was the weird thing. They went home with me and they said, well, because at the time we actually had up in Sahara West, we had this area where we had all these clothes laid out, right, and it was donated to us. And my intention was I didn't want to bring this bug home with me, so I was going to take each clothes that I wore and I was going to throw away or burn them, whatever I needed to do. Sure. And then I'd go in the backyard, I'd go into my jacuzzi, strip down naked, jump into a jacuzzi that was full of chlorinated water. Well, these guys decided to record that, And then even worse, a little bit of that is in this video, this documentary.
So we all can see you naked.
Well, at least the top part, which isn't really attractive.
Interesting. So, okay. All the ladies listening, that's one more reason to watch this. When does it come out and where can we watch it?
So right now it's going to be in the big screens in Italy. Italy is the one that did it. It's going to be in the big screens in Italy. It's going to come. I want to say that'll happen in October. And it's a really, really, I shouldn't say good video because I'm on it. That's kind of tooting my own horn, but it was really good documentary.
It's real life stuff. You're talking to this homeless guy who lives in the tunnels. By the way, like all these storms we've had.
Yeah.
My understanding is when it rains, by the way, in Las Vegas, it floods pretty fast and people drown in there.
Yeah. They drown in it.
I mean, that's dangerous stuff, man.
No, and this guy is in a wheelchair now. I mean, it's really, it's kind of a sad story, because that was the first thing I asked director when I saw this, like, can I help that man?
Yeah.
And unfortunately, a lot of people that choose that life. You really can't help them as much as
drug addiction. You have to be able to go to meetings. You know, it's funny because I know somebody in my life. Well, it's not funny, but it's a good happy ending here. I know somebody in my life who was addicted to meth. Okay. And this was about 6 months ago. He was at his last end, man. This is a guy with a really good job, really nice guy. He was about to lose his job, lose his friends, lose his girlfriend, lose everybody. And he was crying to me, Brian, I don't know what to do. And I said, well, here's what I want you to do. And I gave him some numbers to call for some meetings. And that was the best thing in the world for him, because you don't have to say where you work.
Right.
But he started going to these meetings. His girlfriend pushed him to go. I pushed him to go, and he went. He is a completely different person now. Now he still goes through the everyday stresses, and the problems he has now is when he goes through his stresses, he actually has to deal with them as opposed to just doing drugs and blocking them out. So he's kind of adjusting, but he is much healthier. He's a better person. He treats people better. And all he needed was people that have the same problems that he has to share their stories. And he shared his with people that listen. And now he's like, God, I can't believe I did that to myself.
Yeah.
How could I have put those things in my body? I see, and every time he sees like a homeless person on the streets, he goes, I was one step away from being that.
Yeah.
You know, I just think that's so important to just talk to people.
I think that's one of the things that Sahara West Urgent Care is going to do, is they're going to start working with behavioral health. And when we talk about mental health in our country, you know, there's an estimate in the UK that 1 out of 3 people have a diagnosed mental health condition. That's a huge number. And I think that we've all had such stress over the last few years that all of us probably need that person to talk to and say, look, this is what I've gone through. This is what I'm going through. You don't need to necessarily offer a fix, but listen.
Sure,
you know?
sure.
And I hope that we see more people, you know, really taking advantage of the mental health option here in Vegas and everywhere else.
Well, Doc, we're almost out of time here, but I want to give you the opportunity. I've been to a lot of urgent cares in 20 years, sadly, in Las Vegas. I've been to a lot. I've had my health issues, and I got to say, Sahara West is certainly, they treated me better than anybody else over there. Tell me a little bit about this place.
You know, Sahara West is one of the best urgent cares that I've seen thus far. Just like you said, you know, a place that goes and they really care. They really try to get you in fast. If you're in an urgent care, you need an urgent response. You need an urgent attitude. And that's one of the things I love about Sahara West Urgent Care, is that they give you that. There's urgency in what they do. And if you want to go into a place, the last thing you want to do is be sitting there and not feel like they at least care enough to try to get you in.
And, you know, a lot of these places, I've had to wait for hours just to see a doctor for like maybe 2 minutes. And it's like the opposite there. It's like a close-knit family almost there. And I really like that. It's like it reminds me a little bit. You go into this restaurant that's a chain restaurant. They might not be as friendly to you, and the quality of the food might not be as good. But if you go into this family-owned restaurant, right, and they know people, and it's a community in that restaurant, the food's going to be better. The service is going to be better. They're going to treat you better. I guess that's the best analogy I can make to this urgent care. And I was in and out of there in like 20 minutes, man. It was unbelievable. And I recommend it, highly recommend it for anybody. Sahara West Urgent Care, located at Sahara and Jones. No appointment needed. Well, Dr. Michael Bradley, I appreciate you coming on. I actually look forward to watching this documentary. It actually looks all seriousness, besides seeing you with your shirt off. It does sound like a really interesting documentary with different perspectives from different people and how COVID has affected them, whether it's their job or their life. So I'm really looking forward to seeing that. And we'll have you in again soon, my man.
Sounds great.
Always a pleasure. Thank you so much for being here. Appreciate all that very important information. All right, folks.